How long after immunosuppressant treatment can a child return to school? And I'm assuming that we are all assuming that we're asking in the post kind of COVID landscape, sorry, in the ongoing COVID landscape about that answer.
Yeah, so I think if you're just on, I think if you've recently finished cyclosporin, I would say relatively soon. So, if you finished it, a couple of weeks ago, then I think that's fine to go ahead. Your T cells will recover very quickly. The cyclosporin gets out your system pretty soon. So certainly within a couple of weeks, I think that would be fine. If you've been on high dose steroids, it's going to take a much longer time to recover. And certainly if you're on steroids for a long period of time, you can't go and you still need to be shielded. I think those are individual decisions that you'll need to talk to your team about. And so it's about weighing up the risk-benefit ratio of staying at home, which is really hard to do. And that needs to be weighed up versus the consequences of going back to school. I've got a couple of children who are on cyclosporin, and I've said that it's okay for them to go back to school. But if you, as I said, if you've recently gone back, if you've recently had a transplant, then that's not an option. So I think this is very individualized now. But in terms of immunosuppressants, if you've recently finished cyclosporin within a couple of weeks, that should be getting out your system, and the levels will be a lot lower. Yeah, anything where I think if you're more than 5 milligrams per day of steroids, then that's probably starting to, that will affect your immune system. I should point out though, so for example, if we take, I know this is not aplastic, but if we take our children, for example, with leukemia, who we see huge numbers of in our hospital, the vast majority of children with leukemia, we're now saying go back to school. Okay, and these are children on treatment, and it's only children with very intensive treatment who are in hospital. Those children who are getting outpatient treatment, the vast majority of those are going to go back to school. Okay, and so those are national recommendations, not just mine. So that gives you, we've gone from one level in March, we're saying all of our children had to stay at home. So now we're saying the vast majority of them should be able to go back to school. That I appreciate is a complete change, and for many people will be really stressful. Okay, and I get how stressful it is. If you've been shielding for 5 months or so and suddenly to say going back to school, that's really hard. And psychologically, that's really tough. But for the vast majority of children, we do think now you can hopefully go back to school. But I think that requires an individual discussion with your treatment team if there's specific issues, steroids, immunosuppressant, etc. And I would encourage you to discuss that. The absolute people who cannot go back to school are those who are bone marrow transplant patients, certainly within the first few months, and those who are neutropenic or have very few lymphocytes. Then absolutely no. Most people should be able to go back to school.
Thank you, Phil, for that. Thank you for that answer.
The one thing I would encourage you to do is go and speak to your local units, because these are all very individualized cases. What I'd encourage you to do is go and speak to them. I think that's the message I would, because they know your children, your case individually. I've tried to give you some broad brush strokes, but I would go and speak to them because they know the exact details. And that's normal, okay? So I spend every single outpatient appointment I do now is talking about should you shield or not. So as a clinician, I'm expecting that. And so I would ask you to go and speak to your clinical nurse specialists and your consultants, because they're the ones who best know what to do. And we can write things in black and white, but there are often nuances that may well say, actually, you should stay at home, or actually, no, you can go. And so I'd encourage you all to go and discuss that, particularly with school coming up now in a few weeks' time.